Good afternoon, everyone. I'm excited to be here for this session today. It's something that I'm really passionate about. I'm Neha Deshpande. I am one of the hospitalists at UW-Montlake, so that's my clinical hat that I wear. I also work really closely with SHOM in support of the faculty development program, working on division mentorship and directing our divisional mentorship program as well. So this is an arena that I get really excited about talking about. And I will keep an eye on the chat, but I'm hopeful that you'll unmute as you like and share ideas and ask me questions too as we go along. What I'm going to focus on during this, I guess, like next 50 minutes or so, is how to optimize menteeship. So thinking from the perspective of a mentee. I'm going to cover ways in which mentorship can strengthen your career, and then spend quite the bulk of the time talking about some strategies for how to find mentors that are the right fit for your individual professional development. And then end with some tips for cultivating a mutually beneficial mentorship relationship. Before we get started, Julia and Amy, I want to hear a little bit about what your mentoring experiences have been like. As part of this certificate program, have you connected with someone to support you with your project for their certificate? And have you had any experiences where you might be serving as a mentor? Just what has that landscape been like for you?
For me, since I'm older and trained in the late 90s, we didn't have mentors for anything, anytime, or any place. It was not a thing at Vanderbilt. And I've just come back into medicine, and I have my meeting with Shom was probably one of my best. Like, let's talk about medicine. But I'm the internist working with endocrinologists, so I feel like they're not the right people to be my mentors, and so I'm using this to take the leap and try to find a mentor. And I certainly don't feel like I could be a mentor for many people, at least because of my weird circumstances. That's what I'll say.
Thanks, Amy. So I'm excited to cover strategies for finding mentors that are the right fit, right, for your individual needs, and how to have those things be aligned.
I am pretty new back into the academic world, so I can say I had some clinic-based mentorship when I was working out in sort of community practice. In working on my project for this program, I connected with Helene as well as with Brock Gaster, and Brock was a really good fit for my project, so it's been helpful to be able to pick his brain and sort of bounce ideas off of each other, and also sort of learn from his experiences navigating the sort of the academic process. And then I sort of think about mentoring from people who have helped me sort of learn more about the process that I'm using in my project. So I have mentors who are not in medicine and look for their advice pretty frequently.
Yeah, thanks so much, Julia. I will talk about the benefit that you've seen of having multiple people in your corner, right? And having how they can complement their contributions to your overall career development. Welcome, Katie. To get started, we're just hearing about everyone's mentoring experiences and also checking in that all of the certificate participants have connected with a mentor to help with their project as it relates to the certificate. Would you be okay jumping in next?
Yes. And remind me, are we sharing when we've been a mentee or a mentor or both?
Actually, both.
Okay.
Well, yeah.
And I have connected with Shom. We've had some scheduling snafus on my end and dynamic, but it's good because it's giving me more time to construct my teaching portfolio. So, which is a behemoth of a task. So it's been good. I well, I it helps me. I think as a resident, I got some kind of didactics on what mentoring can look like in your career. And so it helps me to kind of put people in different categories. So having like career sponsors, people who kind of can um uh usually in like a higher level who can say, connect you and help with networking and things like that. And then I have career mentors, but then I also have like research or project mentors. And sometimes there's both and sometimes they're separate. And I go to them for different types of advice, and it helps me to kind of compartmentalize sometimes. And I think when I was earlier in my career, I needed my mentors to also be an emotional support. And as I've grown in my career, I don't rely upon my mentors as much to like I don't expect emotional support in a way that when I was a medical student, like those two things were completely intertwined. And now I have mentors that I can just go to for like career advice, and I don't have as much I don't need as much of like a hug from those people in a way that I did earlier in my career. which is good because when you can I think sometimes if I didn't feel like I was being emotionally supported by a mentor when I was earlier in my career, it like was detrimental to that relationship. And now I don't like, sometimes I need that from some people, but I don't need that from every mentor relationship that I have, thankfully for that person.
Really great points in there. I love that insight in how your needs for mentorship have evolved over time. And so then the relationships that you're having need benefit from now have different like features and strengths. And those different roles that different roles that mentoring can come into play, like sponsorship and coaching, is something we'll talk about too. So we'll dive right in. I wanted to touch on the benefits of mentorship, many of these which you've already articulated in your experiences and as well borne out in the literature. In academic medicine, mentorship is really important for productivity, satisfaction, opening up opportunities. And there are also these less tangible outcomes of mentorship that I also think are really important when we're thinking about fulfillment and confidence in our roles. And I think what drives a lot of us is like having impact on the people and populations we care about doing better by, our students, our patients. Mentors can help decrease the activation energy and increase the efficacy of our impact in doing good in the work we want to do. Something that I feel really privileged in the hats that I wear is getting to have conversations with students, trainees, and early faculty about what makes them feel like they've done good work that day. And I get at this nugget of like what people find meaningful in their work. And I think mentors can help clarify that and strategize how to open opportunities and open doors to align your work with what brings you meaning. It's really this intersection where your core values and your passions and your strengths come together and are aligned in the work that you're doing. The reason this is especially important for faculty is there's evidence to show that faculty who spend at least 20% of their time on meaningful work had lower rates of burnout. And I don't mean having 20% of time protected to do a specific thing. It's in your work, are you engaging in things that you find meaningful? So did you have that family meeting in a way that really clarified what is important to that patient going forward in how they're spending their time. Did you have that light bulb moment with your learner where they were able to grasp the differential diagnosis for AKI? So cultivating opportunities to have those moments of meaning in your career, super important. And I think mentors are key in creating those opportunities. I really like this figure. It was published in as an academic medicine last page a year ago that describes the mentee's journey. And what I'm going to focus on is this earlier part here. This launch into a search, and where the mentee is focused on really figuring out some self-reflection, individual work on what do I need, and then looking for mentors that can meet those needs. So navigating that search. We'll start with some of the work that's done individually, really spending some time and reflecting and writing. The reason this part is so important before you start even meeting with mentors is having an understanding of what are your core values and what are your needs from a mentoring relationship. There are different tools that can help clarify this. A lot of people have professional mission. So what is that actually writes down explicitly what is that area of meaningful work that I'm hoping to engage in. There's a lot written about mission statements, not something that I'll dive into much detail today, but wanted to introduce that as a possible tool. It can be helpful to spend some time reflecting on what are your work style and habits? How do you like to communicate? In developing an effective mentorship relationship, setting expectations around that is going to be important for being successful. So taking the time early on of what works best for you, so you can come into those meetings with that understanding is helpful. And again, really, like, what are your 1-year goals? What are your 3-year goals? What are skills, knowledge, and opportunities that you want to pursue? Helps the mentors that you're meeting be really clear on, gosh, okay, this is how I can help this person and what they need. A tool that can really explicitly clarify what your goals are, like an individualized development plan. That's something that's required anyway as part of our annual review materials. So it's something that you have to do that can be helpful in clarifying your goals for your career development and mentorship as well. I talked a lot about IDP, mission statement. A tool that I find really helpful that I wanted to introduce more specifically is taking a few minutes to write down what in each of these 4 categories. Ikigai is a tool. There's a TED Talk by Tim Tamashiro on finding your life's purpose that I think is really interesting. And you can take a look at if you'd like. Figuring out where these areas of intersection are. Like, what are you good at? What do you love? What can you get paid for? And what does the world need? Can clarify those areas that bring meaning, align with your core values. And then as you pursue those opportunities, you can take that to a mentor who can support you in pursuing that kind of work. All right. Any questions or comments about some of these tools or reflecting on core values? I'm curious if any of you have done some of this pre-work already, or if some of these tools are kind of new to you.
I unmuted because I was curious about the same thing. And I also wanted to share that, like, thinking about, so 2 slides ago, you had a slide with like things to reflect and write. And just looking at that stressed me out. It's like, I'm not going to write about my feelings. But then the Ikigai tool, that looks really kind of bite-sized and doable. Like, I can actually write something in each of those boxes in a way. So I just wanted to say that tool seems, and I've done kind of similar tools. So there's something about doing it in a way that's accessible versus like just sit down and write your mission.
Yeah, thanks, Sean. Yeah, I'm curious if anyone else has utilized similar tools or done some reflection work in this space before, or if this is feeling kind of like a new territory.
I think I'm kind of like Sean, like I get a little overwhelmed thinking about writing a personal mission statement. There's a great book by a dancer named Twyla Tharp, sort of legendary choreographer in her 70s, who is just like a powerhouse. And she writes a lot about using mission statements in arts work. So I love that there's overlap, and I was equally overwhelmed when she suggested that in her writings. So I appreciate the Ikigai idea. It feels more like, oh, I can come up with tidbits of information about what feels important to me or where I see a need.
Thanks, Julia. Yeah, I think that resonates with a lot of people where writing a mission statement feels like really big and ambitious. Uh, and what do I love feels a little bit easier to answer as an intermediary step to perhaps drafting a mission statement. Anyone else? Yeah, Helene.
I love this overlap with what I call passion mapping. And another way to think about it is, think about a really good day at work and then just ask yourself, what are you doing that makes it a good day? And sometimes it's a little easier to get concrete when you're like, what do I love? It's like, I don't know. And sometimes that can be a little nebulous, but I find that if you reflect on a day when things just feel like it's really working, to ask yourself the question of what happened today to make this such a good day can sometimes be also another way into thinking about what it is about the work you do that's satisfying and fulfilling. Similarly, what's going on in a bad day can also sometimes you understand what you like by knowing what you don't like. And so it's useful to be able to think about those differences because sometimes you can flip something bad and turn it into something good. If it's just like, who knows what the circumstances can be sometimes. Anyway.
Yeah. Thanks, Helene. Yeah, that's exactly one of my favorite questions I get to ask when I'm interviewing people, medical students for residency is like, tell me at the end of a day what made you feel good about today. And those even early trainees have an idea of like what sparks joy for them consistently in their work. So yeah, accessible even for our early trainees.
I float another possible tool, and Neha, maybe in your mentorship work, you can comment on whether you've come across this or not, but I did a designing your career workshop, as I shared with you, Neha, a week or two ago. And one of the pre-work included doing an online kind of a survey type thing where you narrowed down to what your values are, and another one that helped narrow down to what your strengths are. And I found that really interesting because it may not necessarily reflect what my values and strengths are, but what they are, what I want them to be, I think, at a minimum. And so I learned a lot about kind of what I was hoping for in my career. And it seems like that could inform as well, kind of a conversation with a mentor.
Yeah, so that intersection of strengths and values and passions ties so deeply to that meaningful work. And that is the heart of your search. When that has having some clarity about that, and then launching into a search for mentors that are going to help you fulfill that vision for meaningful work. So I'll dive into some strategies for that search for really the mentors who are the right fit to fulfill that. I will start by saying this takes time. Often the first person you meet with may not be actually the right fit, but having iterative conversations further clarifies what are your values, what are your goals, where do you find meaning? And the people you meet with can make introductions and make connections and help further the search towards a mentor who's going to be the right fit. Start off by meeting with people you know. People are really happy to make recommendations and make warm introductions to people in their own network who might have aligned interests and goals with you. Some persistence here can really pay off as you just meet more people, get clarification on your values, and maybe even get new ideas for your interests. I will shamelessly make a plug here for where I can be helpful with this. With the mentorship program, our program has a footprint in the VA, Harborview, and Montlake inpatient and outpatient clinical sites. And we are primarily tailored to early career faculty, but this is a resource that's open to everyone who is hoping to expand their network and their mentorship panel and meet with a mentorship champion who can help leverage their own network to make connections to further your career. So that's a plug, and connect with me if this is of interest of you. And what are you looking for? I'd suggest look for a mentor who's available and accessible, who is supportive of developing your agenda as a mentee. And I'll talk a little bit more about that. The ideal mentor is going to provide opportunities and provide guidance and support and encourage you to take risks in support of your vision for a meaningful career. Someone who has mentoring experience can be beneficial, and someone who has a lot of experience and a lot of active mentees may not be the one who's the most accessible. So I offer that with a little bit of a qualification. In the mentors that you've all worked with, what are some of the qualities that you found really effective? Qualities of a mentor that have worked really well in meeting your needs. And feel free, anyone can unmute and offer what they found in their experience helpful from a mentor.
I can fill the time as other people think a little bit more, but I've been thinking a lot about this. I think one of the things I noticed was like it's not necessarily super comfortable talking to a mentor. It's like you can feel uncomfortable and they can kind of stretch things. You know, like the example I always give is Tom Gallagher always kind of telling me to think bigger. Like I like to think small, and he's like, think bigger. And that's not really comfortable for me. So it's not that it has to be like you always feel great the whole time you have a meeting with them. I mean, it can also make you feel not so great, maybe, or feel challenged, I think is what I'm trying to say.
Yeah, like a safe and secure level of discomfort. Discomfort in the stretch. Yeah, I love that. Any other reflections?
I personally have really benefited from mentors who I think I've been very transparent that I'm early on in my career and I need people who break me out of that sense of imposter syndrome and saying these are opportunities that are reachable opportunities for you, as opposed to assuming that it's something that I have to be many more years down the road to pursue. And so I benefited a lot from that type of mentorship. And similarly, not necessarily knowing exactly how promotion and like some of the nitty gritty of what it means to be in this career means, and not knowing the questions to be asking
Mhm.
is really hard. And so people being transparent about, you know, what the how I need to be advocating for myself, especially as a woman in medicine, is important, and something that I sometimes don't have the words to ask. And so the mentors that I've had that have just been really upfront with like, you need to be doing this, has been incredibly helpful, because I wouldn't even have known to ask for that type of advice.
The kind of helping you with things you may not know or not have experience with, and Yeah, great. Thanks, Katie. Any other?
I was just going to say that even though I said that I don't have any mentors, I'm sitting here in this hall because all of these great endocrinologists around me, even though I haven't assigned any of them as a mentor, they my life's been in turmoil and I just been putting one foot in front of the other, but they have all shuffled me along, giving me opportunities, which has been really amazing. I just haven't labeled one of them as a mentor. I actually consider the whole department mentoring me. You know, they invite me to this primary care and diabetes talk right now, which was a huge opportunity that these fall into my lap. And so going forward, I hope to be more intentional with plans and people who are already actually reaching out to help me right in front of my face, you know.
Thanks, Amy. I'm so glad you have those people in your corner. And I think that resonates a lot for faculty on both sides. Like I'm reach out to this person for help and they always help me. When do I get to formally label that as a mentor? And we can talk about formalizing that and kind of how do you shape expectations around that then in a little bit. Anything else anyone would like to share? I heard thoughts around this kind of early as we were getting started, looking for mentorship and where to look for it, kind of looking outside of your clinical group or even sometimes your department or division for people that might have aligned interests or shared experiences and can offer an angle of support towards your career. Once you've found one person who's a great fit, continuing to build out a mentoring team that can include kind of these cross group, cross institution relationships. Also looking for junior and senior people, having a mix of people so you can reach out strategically to different people when you have different needs. No one person can probably meet all of the needs you might have. And a team of mentors can use their strengths in a complementary way to contribute to your overall career development. Katie, you referred to these different archetypes and you recognize contributions in your own development. I just wanted to share a little bit about how these roles can come into play. We all think about kind of that traditional mentorship relationship where you're meeting with one person regularly over time, perhaps for a project or advancing career milestones, super helpful. And we all can use from time to time coaching, like Helene for getting a project protocol off the ground and running, sponsorship, opening up doors to speak at a diabetes conference, connections, connecting to someone who perhaps practices clinically in a different setting, but is really invested in the care of the older adult population and can support a project idea in that way. And then plug for peer mentorship too, someone who's experiencing perhaps the same challenges and struggles of a similar stage in career, bouncing ideas off of each other, can provide some of that emotional support that might be again important as we transition through different phases of our careers. This is a figure that is not yet published. A couple colleagues and I have this in submission, but it summarizes what I think is important of the way a team of people can contribute overall to your career. The idea of having a board of directors, just like a corporation might have, where different people are focused on different aspects of moving, not a corporation, but you and your overall career forward, leveraging guidance from mentors, sponsors, coaches, advisors in advancing your career, opening opportunities, and meeting your overall goals. All right. So mentors, sponsors, coaches, this whole team can provide guidance in a lot of different important arenas in your overall career. I think this map is really useful in thinking about what some of the needs might be. I'll give you a few moments to reflect and think about this in the context of you and your own career development. Where do you have the support that you need? And what are some areas where you're noticing some gaps? And so I'll give you a few seconds to reflect on that. And if you're able to reflect out loud and share what maybe some areas of mentorship gap are for you, I would love to hear about that. Are there any arenas where you're feeling like you might need more support from a mentor?
All of them, all of them. That's all I'll say.
Thanks, Amy. And this is exactly why one person can't fulfill all of it, right? You might have one person providing support in a couple of these needs. Maybe the domain will shift over time. But gosh, one person will not be able to fulfill all of this. Any other gaps in mentorship?
Not necessarily a gap, but I think I'm starting to see how you can maintain these relationships outside, outside of a particular institution, or even, like using any of the national organizations to find mentors or sponsors in these various spaces. I would say my project specific guidance, I have more of that with my prior institution, like the manuscript I'm writing and the mentorship I'm getting from that is from my prior institution, but it feels kind of not awkward necessarily, but since there isn't connection through University of Washington, it feels like people don't necessarily know that I'm also working on that simultaneously. And so the and I'm not being paid to do it, obviously. Which is totally, I'm growing in my career, but just recognizing that even if it's not within your institution, there's still very wonderful mentors that are contributing to my growth in my career.
Yeah. Thanks, Katie. Any other areas that folks are recognizing as an area where they might need more support from mentors?
I was reflecting on a conversation I had with my husband earlier this week. And sometimes when you're just having a conversation with, a loved one, there's that sort of reflection back. Well, did you realize that might, you were thinking of it as an opportunity in this way, but he saw this interaction that I had with a colleague as like, oh, but maybe you actually need to ask them this question. Like they may be able to help you better if you see them in a different light. Like they may not be able to help you with A, but they actually could be somebody who could be really useful for you for B. That was kind of cool to, I don't know, get that different perspective. So I have a good emotional support person, I can tell you.
Oh, I love that. The same person might be able to contribute in different ways than you might have initially thought, or like even over time as circumstances, goals, needs evolve. I think in reflecting on this map for my own mentorship and career, I can put people in multiple places and have moved people around the circle. And something that evolved as a need over time was actually cross-institutional collaborators and opening up opportunities that way. And once I realized, gosh, this is an area that's increasingly becoming a need, then I was able to intentionally try and seek out connections to fill that need. That's actually what led to some of the really awesome people I've been in touch with putting together that board of directors figure that I showed y'all earlier. So yeah, I think over time, or coming back to this sort of an iterative way and seeing how this might have shifted and where do I need to go from here can help with a more intentional search.
If I may add to that, I think, Katie, it's like you're kind of in the place in reverse where you're coming with the interinstitutional relationships and then you're needing to build those out locally. But I think keeping in mind that those interinstitutional relationships are also part of what helps you get sort of your work out beyond the single institution. So while you may be really focused on something that was sort of finishing work from your past, really thinking about how that opportunity to co-create something together also is a foundation for future collaborations, where you could be coming from it no longer in your previous role, but now sort of a opportunity to forge forward with additional work coming from your current position. So I just say that mostly out loud to remember that it is always when everyone's like, oh, but you only did this in one institution. It's actually your friends from your past who are now scattered around the country that make for the capacities to think about maybe working on a project with other folks in other parts of the country. So, and also knowing that everyone is sort of wanting those same things. So it's not a big out of bounds kind of thing to say, hey, what about this? Because everyone benefits from that kind of work. So
Thanks, Helene. All right. So now that you have done that pre-work of figuring out what is important to you, what brings you meaning, you started looking for mentors who can help fulfill that. Now you're ready to prepare for that first meeting with a prospective mentor. And this is where being specific about expectations and like formally saying this is a mentorship relationship can help ensure over time that your goals are being met. I think it's helpful to be explicit about saying, hey, I'm looking for a mentor, and coming to that meeting prepared with an agenda for the meeting. This can feel a little intimidating, especially if you're meeting with a mentor who's perhaps more experienced or more senior. Like, how am I going to tell someone who's more senior what is important to talk about? And I think people who are well poised to be great mentors are actually looking to support your own agenda and are hoping to hear, what do you feel is important to you, so that they can help meet those important goals. I met with Shom actually yesterday, and I think I used those specific words, like my agenda for this meeting is to cover these things, and I had it written down, bulleted. Early on, I took a meeting with Trish Critic, who is like probably a mentor exemplar and one of our deans for faculty development. And she asked, what is your agenda for this meeting? And I did not have one. And it was a moment of embarrassment, actually, and growth to come prepared in the future with an agenda. Most people are really excited if you reach out and say, I think your career is really cool and would love to learn about your path to doing this work. It's kind of flattering, and people are excited to spend the time to talk about that. And sometimes people can feel a little hesitant to ask for that time, but I would encourage you to reach out to people whose work you find interesting. Ask questions about their career and the twists and turns it might have taken, and also share about yourself. Share what you've learned from that self-reflection work that you've done, what your goals and needs are. And then follow up with a thank you and say, gosh, I would love if we could continue to meet with you as my mentor. What would work is meeting every 3 months, or to really get this project off the ground, would you be willing to meet every month? Set up a meeting schedule. And if after that first meeting you find like, gosh, maybe this is not the right fit, okay to be grateful for the time spent, and then ask for suggestions for who else might be useful to connect to. All right. So moving along that mentee journey towards this middle section where you're building this relationship with your mentor. Mentoring relationships are often most successful when they're mentee driven. And I want to empower all of you to manage up with your mentor, set those goals and expectations for what you're hoping for from that mentorship relationship. Plan out the schedule of your meetings and the agenda for what you're hoping to discuss at each meeting. And then it's okay to formally, even by a follow-up email, summarize what you talked about and follow up on tasks. That in 2 weeks, I will send you a draft of a project protocol. Ask questions, actively listen to your mentor's advice, and ask for feedback to help support your growth. We've talked a lot about like what to do as a mentee, reflecting and writing, taking the time to search for mentors who are the right fit, and then creating a team, as well as managing up in that mentorship relationship. I wanted to take a few minutes to talk about what not to do. And this is from an article that was published in JAMA in 2017 for common pitfalls and mentee missteps. The tendency, or I guess avoiding overcommitting, right? It's helpful to be insightful about your bandwidth and avoiding saying yes to everything and overcommitting, and then the pitfall of underproducing. Where insight into what is meaningful work and what work aligns with your mission and goals can help you be strategic about what you say no to. The other pitfall is agreeing to tasks and then failing to follow up. Often this happens when speed bumps or problems are arising. A strategy here is if this is really something that you can't follow through on, passing the opportunity forward and perhaps sponsoring someone else for whom that opportunity might be exciting. Doing this proactively and early to allow for like alternative planning helps avoid things falling through kind of at the last minute where things might need to be culminating and executing. The other pitfall is where the mentee is constantly fulfilling and spending energy on the mentor's agenda and needs and not what supports the mentee's agenda. This is where having clear expectations early can help, and having a mentoring team. So you're not vulnerable to the agenda of just one person, and those other mentors can help you navigate what might be a sticky situation if you're constantly feeling like you're pulled to serve the mentor's agenda instead of your own. Other common pitfalls, the mentee that constantly needs attention and supervision needs to reach out for guidance for every like small move. Peer mentors are great for this because they, someone at the same stage often has the same areas of struggle, and you can actually help each other with bidirectional support there. That being said, I do want to normalize asking for help. Never asking for help and being the lone wolf is another pitfall. And mentors, that's what they're there for. Most of the people who provide mentorship, who I get to speak to, the whole joy and meaning for them in that work is paying it forward and furthering someone else's career. So they're actually really excited to do that. And then the last pitfall that the authors describe here, I actually think is more rare. But the mentee who, when things don't go well, shifts blame or makes excuses, I think cultivating some grace and accepting responsibility for when things don't go well, and then growing from that and applying those lessons learned to future endeavors as a way of mitigating that. Okay, so hopefully over the last 45, 50-ish minutes, I've convinced you all that mentorship is super critical for advancement and productivity and satisfaction, having impact and finding meaning in your work, and finding the mentor who's a right fit. Developing those relationships, developing a team of mentors takes time, preparation, and intentionality, of which there are formal tools like the Ikigai, or even thinking about what made you feel good that day can help you have clarity in that pursuit for suitable mentorship. So with that, I'll pause and encourage all of you to take a couple minutes in thinking about where you are for your search for mentorships. What are 2 immediate next steps that could be helpful? And write them down. One of your immediate next steps might be emailing me and getting in touch with a mentorship champion. Yeah, and with that, I'll take any questions, comments, reflections in the last few minutes together.
Thank you so much. I'm going to jump off and do my first lecture at Utah.
Yay.
Okay,
Great.
bye.
Good luck,
Bye.
Amy.
Bye.
Super exciting. Be sure to do the evaluation, and I'll just mention the evaluation has a kind of a video consent, and feel free to say no if you don't want your video on YouTube, and we'll just chop it out. But if you say yes, we might leave this one as is if everyone says yes, because there was so much discussion that I think others might benefit from. The link is in the chat to the evaluation. That was great, Neha. I feel like I learned something new or have a new reflection every time you present about mentorship and menteeship.
Well, thanks, Shom. Given that you are one of my mentors, I feel like I should give due credit that I've learned some of this on my journey with you. And really excited to pay it forward as I start to mentor more.
Me. Thanks, Neha.
Yeah, there's a little mentorship genealogy actually in this group. Well, thanks everybody. Happy to give you a few minutes back if there are no further thoughts or questions. Oh, Julia.
I was just going to say thank you. And I was thinking about the mentorship genealogy, having Helene here. She and I share a name. My middle name is Helene, and we pronounce her name the same way. So that was enjoyable as she was coaching me late last year and early this year. But I think one of the great things about working with Helene very specifically, so I'm just going to brag on her for a minute, is that she actually helped me step back from my lone wolf tendencies, and she may not have realized that she did that. But her encouragement to sort of in advance set up our meetings and have a plan for each meeting helped me learn how to be an effective mentee. So I am appreciating her for that.
Yay, Elaine.
That's great. Thank you for sharing that praise.
All right. Thanks,
All
everyone.
right. Bye, everyone. Thank you so much.